Let's try to get some clarity on this issue. Bill Keevil is a professor of environmental health care at Southampton University in the UK, and he joins us now live. Thanks for being with us. Do we have any idea why asymptomatic carriers actually don't show symptoms in the first place? Is there something in their body chemistry that actually protects them from this disease?
Well, asymptomatic carriers have been well known for many, many years. There was a famous case of Typhoid Mary, who was a cook in New York in the early 1900s. She didn't show any symptoms, and she gave many people the salmonella infection. Other diseases, even the influenza virus, will give you a low percentage of cases. We don't know why. It's some genetic factors, but we don't know what they are. But what is worrying is the fact that these people appear to be infective sufficiently that they can infect other people, which is, of course, of major concern when we try and track and trace these people.
Right. Do we know even, though, if they develop some sort of antibodies, do they have any protection at all after carrying the virus? Now, I'm assuming, I might be wrong here, that they also would only carry the virus, for 14 to 21 days, as is the normal path of people that carry it. And then assuming after that, do they have antibodies? Do they have protection of any sorts?
These are very good questions. You really need very detailed virus detection technologies, such as the PCR test. And at the moment, few countries are doing very large-scale screening. So it's likely that many people do have this virus without showing any symptoms at all. And now that the antibody test is coming online, we're now realizing that people who are testing positive for the antibody test and have never reported any symptoms, and in fact, they are surprised when they're told they have been infected.
And tell me as well, is there still a major problem with those antibody tests not being accurate? I mean, this is so crucial to be able to understanding this virus, and yet we're finding out that a lot of the antibody tests are turning out to produce false positives.
This is perfectly true. I mean, the UK government made a major commitment to buy an antibody test at the very start. But when the test arrived in the UK, it was just not good at all. So they had to cancel the contract and wait for a much more robust test to come out. There's at least one now which the UK government can rely on, and so they're buying that. But one of the issues, there are many home tests that you can buy off the internet. Most of these have never been validated, and they may not work at all, and they may give you a false sense of security.
And overall, Bill, I mean, we're still across the world not really testing enough people to fully understand how pervasive this virus actually is and how many asymptomatic carriers there may be. We've been told by governments all over the world that there just is no way to test as many people as would need to be tested to get that kind of accurate information. But let me ask you something. Is it safe to say that, if we crack the mysteries of these asymptomatic carriers, we would maybe be able to cure coronavirus much sooner rather than later?
Well, if you can understand why they don't show symptoms, that's obviously very important, because if, say, there's a genetic factor, then you can design a drug that mimics that genetic factor. And so when people start to show serious symptoms of COVID-19, then you could actually then give that drug. So it's well worth pursuing and understanding why asymptomatic carriers are apparently not showing symptoms.
Okay. We're going to leave it there. Bill Keevil, really, thank you so much for joining us. We appreciate it.